Epinephrine, commonly known as adrenaline, is a chemical that narrows blood vessels and opens airways in the lungs. Adrenaline is a hormone that is secreted mainly by the medulla of the adrenal glands and functions primarily to increase cardiac output and to raise blood glucose levels. Epinephrine is normally released during acute stress, and its effects are known to prepare an individual for either fight or flight, which is why it's a primary medication for non-perfusing cardiac arrests. One of its effects is also reversing low blood pressure. Let's look at some of the indications. Epinephrine is used in cardiac arrest arrhythmias such as VFib, pulseless V-tach, asystole, and pulseless electrical activity. It can also be used in symptomatic bradycardia and treatment of severe hypotension. Epi can be administered via nebulizer treatment for croup and other upper airway obstructions. Epi is also an effective treatment for anaphylactic reactions. Now, some of the precautions and contraindications should be noted. Care should be given when administering epinephrine in cases where raising the blood pressure and increasing heart rates may actually cause myocardial ischemia and increase demand for myocardial oxygen. It should be noted that high doses do not improve neurological outcomes or survival rates and may actually contribute to post-resuscitation complications like myocardial dysfunction. So now let's take a look at the pediatric dosage. Epinephrine is available in 1 to 10,000 or 1 to 1,000 concentrations, but for cardiac arrest, epi should be delivered IV or IO at 0.01 milligrams per kilogram in the 1 to 10,000 concentration. Now this can be repeated every 3 to 5 minutes. Make sure to follow the epinephrine with a bolus of 20 cc's of normal saline. This flush through the line gets the drug into the central circulatory system more appropriately, so it's more effective. If there's no IV or IO access, it may be given endotracheally with a dose of 0.1 milligram per kilogram, but remember now the concentration is 1 to 1,000 for endotracheal delivery. For treatment of anaphylactic shock, epi 1 to 1,000 is given to a patient less than 30 kilograms at 0.15 milligram IM or subcutaneous into the thigh. This dose may be repeated if necessary.